Welcome to this very auspicious launch of the first Australian National Children's Mental Health and Wellbeing Strategy. I think it's fair to say that it is not only an important date for us, but one that we have much anticipated. I would like to begin by acknowledging the traditional custodians of the various lands upon which all of us are meeting today. For myself, that is the Ngunnawal people here in Canberra. I pay my respects to their elders, past, present, and emerging. I also acknowledge and pay my respects to every one of us who knows the reality of mental illness, mental ill health, and suicide. We're very pleased to welcome today our Minister for Health and Ageing, the Honourable Greg Hunt, who will officially launch the strategy. Together with Assistant Minister for Mental Health and Suicide Prevention, the Honourable David Coleman. Both of you are very committed to the mental health and wellbeing of all Australians, including our youngest. Welcome. We'll be hearing from Mrs. Lucy Brogden, the chair of our Commission's Advisory Board, on the importance of this strategy and indeed how it all began. Welcome, Lucy, and also welcome to our fellow commissioners who've been invaluable in supporting and steering this work over the last few years. Dr. Alex Haynes, our Executive Director of Policy, oversaw the Commission's project team along with Lyndall Soper, and he will be conducting a discussion panel with four of our key contributors. Welcome, Alex. We look forward to the insights of your expert panelists, our co-chairs of our steering committee and the expert advisory groups, Professor Frank Oberclade and Professor Crystal Middlethorpe. Welcome, Frank and Crystal. Our wonderful Commissioner, Professor Nye Brown, who has committed her professional career to working with Munchkins, and Dr. Jim Waddesdon, a leader in the field of education and a contributor to our expert advisory group. So many of you who are with us today have contributed to the strategy. Thank you for your input and for being with us today to celebrate this launch. Now, to begin, we have a very special acknowledgement of and welcome to country this morning from our future leaders, the children of Biddy's Joy Playgroup at the Aboriginal Children's Service in Redfern. Thank you.
The Gadigal people are the first people, the first people, the first people. The Gadigal people are the first people to take care of this land. Reach up high, touch the sky, we're on Gadigal land. My mummy is Aboriginal. And then Getty is Aboriginal.
When your teachers are talking to you or talking about Aboriginal culture, how does that make you feel?
I'm happy.
Makes you feel happy? When you're at school, what do you talk about with your teachers and your friends for you to say that you're proud to be Aboriginal?
Australia is our land. This is my dad, and that's a love heart, and it's connected. My family. We always do stuff together. We always do stuff for each other. The Aboriginal people are still here, and we are the Aboriginal people.
Wow, isn't that so special and so very precious? Our future is in their hands. Thank you for that most wonderful welcome. And now it's with very real pleasure I welcome the chair of the Commission's Advisory Board, Mrs. Lucy Brogden, a wonderful colleague and friend, to set the scene of our National Children's Mental Health and Wellbeing Strategy. Lucy has been with the Commission since its inception in 2012, and in her time as chair has overseen and led some incredibly important strategies and initiatives for mental health. I think this ranks right up there, Lucy. Welcome, and over to you.
Thank you, Christine. I'm speaking to you today from the lands of the Guringai people, and I pay my respects to their elders, past, present, and emerging. And as is a tradition at the National Mental Health Commission, we like to acknowledge also those with a lived experience. And today I would particularly like to acknowledge the voices of lived experience that have really informed so much of the work around this strategy. The parents, and where we could, the children, have lent a very strong voice to the development of this important piece of work. As Christine foreshadowed, I'm just going to give a little bit of context to the background of this and perhaps use the indulgence of the chair to share a bit of my personal story in this regard. I was very privileged last century, as my children would say, to work with Professor the Honourable Dame Mari Bashir, an outstanding child and adolescent psychiatrist and also a previous governor in New South Wales. But Dame Mari and I worked in juvenile justice with some really tough and heartbreaking situations. But Mari always held on to the view and really instilled a view in all of us that we could reset the trajectory for these young people if we could only intervene early in life with these children to support them on a very different path. And that voice and that inspiration from Dame Mari has really stayed with me since working with her. And then not long after joining the commission, we had a very powerful briefing from Frank Oberclade down at the Children's Hospital in Melbourne that again was a very powerful voice. The commission was joined by Commissioner Helen Mulroy, who'd come across to us from the Child Abuse Royal Commission, but again, another child and adolescent psychiatrist, just so passionate about the need to recognise, as I would call them, the munchkins, but our children. Taking that collective voice when Minister Hunt was appointed our Minister for Health, and we had the children's strategy at the top of the list. And actually without hesitation or even further argument, we said this is the #1 priority as we see it. And Greg embraced that and just said, get to work, start this. I see the need, I understand it, get cracking. And Minister Hunt was then joined by Assistant Minister Coleman, who again endorsed this important approach to really filling an important gap with a strategy that recognises the needs of our children. The great work has come about under the leadership of Professors Frank Oberclade and Crystal Middledorp and their expert advisory group. And we really want to thank them for that significant contribution. There have been many steering committees, working groups, working right across Australia on this important piece of work to hear as many voices as possible. And today we want to acknowledge that incredible contribution and those powerful voices. In the working groups, including the Aboriginal and Torres Strait Islander working group, we heard important perspectives, child-centred, family-centred perspectives that I hope you can see in the final document. Many agencies of government, many not-for-profits, many organisations working with our children and young people have informed the strategy and provided incredible feedback. And we're so grateful for that contribution. The strategy itself has been designed around 8 principles that will be discussed more in the panel. But importantly, they're around being child-centred, the needs and rights and interests of children, strength-based, acknowledging that services need to look at that perspective and to provide that family-centred approach to care. Importantly, prevention-focused, providing universal and targeted prevention of mental illness by providing and supporting mental wellbeing. That it's equitable. All children and all families must have that fair and balanced access to health, education and social services. A universality applies to this work, that it's developmentally appropriate, culturally appropriate, and it treats children in the context of their families and communities. Importantly, evidence-informed, practice-informed, best practice informed, along with that continuity of evaluation. And that we see that early intervention for those in need while addressing the impacts of trauma and social determinants. And that it's needs-based, not diagnosis-driven. Importantly, we can access the support and care your family and your child might need without the need for diagnosis. Those 8 principles then inform the 4 areas of focus around family and community, around a service system that is so essential. Great work has been done to bring together our mental health sector, which used to be continually described as fragmented, and we've done great work to bring it closer together. Still work to be done, but for our children, a lot of work needs to be done. The education settings where our children spend most of their time, either at school or in early learning, need to be really well equipped to provide the best start for our kids. We need good evidence, we need good evaluation to actually create that virtuous energy and virtual energy that will keep this strategy coming to life into the future. The strategy is available for all of you to access on the National Mental Health Commission website. We will be sending out links to stakeholders, but I would encourage all of you as parents, carers, educators, clinicians, policymakers, leaders in community, please be part of creating that strong mental health and wellbeing framework that we need for all our children today and into the future. So thank you, Christine. Thank you to Minister Hunt and to Minister Coleman, and for everybody that's participated in bringing this to fruition today. What a great achievement.
Thanks so much, Lucy. And again, through you and to all of our commissioners, you're so integral to the depth, the breadth, in fact, the reach of the work that we can do at the Commission to improve mental health outcomes for all Australians. And now it gives me great pleasure to call on Minister Hunt to discuss the federal government's commitment to ongoing mental health reform and why the launch of this strategy is a necessary element of that reform. I am proudly on record many times for acknowledging the tremendous support of Minister Hunt across the spectrum of mental health. On his watch, we have seen some of the most important, indeed groundbreaking initiatives to make mental health services more accessible and more affordable. He's committed to destigmatising mental health and making it as normal to reach out for help and support as it is for our physical health. We've heard from Lucy that this is the first children's mental health and wellbeing strategy in the world. Greg, we acknowledge that it's you who've enabled this achievement. Please now take centre stage to launch it for all Australians. Thank you.
Thanks very much to Christine and to Lucy, to, in particular, Christelle Middledorp, Frank Overclade, to people such as Jim Watterson and the irrepressible and extraordinary Nairi Brown, and to everybody who has been involved in the development of what we believe is the world's first ever full national children's mental health strategy. I do want to start by acknowledging Indigenous Australia and thanking the beautiful children from Redfern for what I think is one of the most powerful welcomes to country that I've had the privilege of witnessing. So we know the challenge, but the message today is there are challenges, but there is real hope. And this strategy is about providing hope and a roadmap to help people navigate their way towards that hope. So the challenge, we know, more than 50% of ongoing adult mental health illnesses and challenges manifest themselves before that adult is 14 years of age. So child mental health matters of and in itself, but it's also the precursor to many of the challenges that people face on an ongoing and chronic basis as younger and older adults. So if we can address this, we're helping the child at the time, but we're also helping the adult to be a decade and 2 and 3 decades later. So that's as human and as important as things are. And we know during the pandemic, all of the challenges that we faced, the challenges of lockdown, the challenges of fear, of economic concerns, all of these things have come together. And so this has been an immensely powerful and important time. A year ago, 15 months ago, there were questions as to whether we would face a tsunami of suicide. And fortunately, through our collective actions, the support of Australians, the support of governments, the incredible work of our health and mental health professionals, we actually saw a decrease in lives lost to through self-harm last year, a 5% decrease, 179 lives down that have been saved. And that's without taking into account the potential increase, which has also been avoided. But there's a huge way forward, and that those outcomes start with helping young people earlier on in their journey. And so that's why this is so important. We also know that our second great challenge is that more than half of children go undiagnosed with mental health conditions on all the advice we have. So against that background, what are the fundamental directions in the strategy? And I particularly want to acknowledge a number of other people. My colleague, Assistant Minister David Coleman, who's a brilliant minister, but moreover, this is a deep personal passion for him. He asked for the job, he asked for the role, and to have that support is incredible. The team of Mark Rodham and Tanya Rishnu and so many others in the department, and the extraordinary Dr. Michael Gardner in my office. All of these people have worked with you to bring this strategy to being. So the heart of the strategy is a focus on wellness, moving with younger children, those under 12, from a medicalised understanding and assessment to a wellness-based understanding and assessment. And the continuum across the 4 stages of the spectrum, from well to coping to struggling and to unwell. And as Christine said when we spoke earlier today in public, parents know their children. We trust parents to know their children, and they are best placed of anybody to recognise it, but teachers, children themselves, often it's what you'd call the silent cry, the messaging of things where people are not coping, where there's that creeping sense of anxiety. Now, nervousness, bad days, these are all part of human existence. So is mental health. And so this strategy aims to make it simple to understand, but also to say to everybody, there's a pathway forward here, that you don't need to worry about the stigma of your child seeking help, of you looking for guidance. That's part of what we do if a child has a respiratory illness, if they have an injury, if they have some form of intestinal issue. We don't think about that, and we should not hesitate to seek that mental health support. And so this wellness framework and the destigmatisation are absolutely critical. Within that itself, there are sort of 4 critical areas of focus. Firstly, of course, there's families and the advice to and the understanding within and the pathways for. Secondly, there is the focus on services, and in particular, the Head to Health initiative, which David Coleman has helped lead and pioneer with 15 national Head to Health clinics for children. So obviously we have very strong youth support through Headspace. We are developing the national support through adult Head to Health, but to have children's Head to Health or Head to Health kids is something that I think this strategy will be known for. This has come out of that work. It framed what we did in the budget. And with those 15 Head to Health clinics, they're the start. They're not the finish. That journey that we've had with Headspace is what we want to do through an appropriate, tailored, designed Head to Health for kids. And the elements of that have been set out in this strategy. It's not the only element, but the third of the principles is, of course, in the education settings to provide the tools for teachers, for counsellors, for others. And then finally, it's the evidence. And all of those are underpinned by the 8 principles, which Frank and Christelle and others will address. But it's a very strong intellectual framework, but it's a practical framework. Then finally, there's the funding. And the budget had $317 million in direct and indirect funding to underpin this strategy. It perhaps was a little ahead of the strategy, but it was completely informed by all of the work that was in progress. And we didn't want to wait. David and I didn't want to wait for next year. We wanted to have the funds in place so as the strategy emerged, you were able to move quickly. And within that, of course, there's the more than $54 million for the Head to Health clinics, the funding for perinatal mental health, $47 million, the $111 million for Medicare funding as well, for families to have mental health consultations for their kids, so to help parents. All of these things come together. So that's the challenge, the framework, and the funding. But above all else, what this strategy is about is destigmatizing children's mental health, encouraging parents, encouraging educators, encouraging younger people who have that awareness to step up and say, I'm not okay. And all of these things are about ultimately saving lives and protecting lives and improving lives. So again, I'll thank everybody who's been involved. I am delighted to officially launch the first ever, a world first in our understanding, Australian National Children's Mental Health Strategy.
Greg, I feel as though there should be a drum roll at that point. Thank you so very much indeed. That was wonderful. Thank you. I would now like to invite the Honourable David Coleman, Assistant Minister to the Prime Minister for Mental Health and Suicide Prevention. I should know that by now, David, to speak. Since his appointment in December last year, I've got to say that David has brought absolutely incredible energy, analysis and insight into how we can improve our mental health system. What can be done to make it more, what I call, accessible, affordable, dare I hope, universal. He's particularly committed to the needs of young Australians, including our children. David, over to you about how this strategy sits with your work on a whole of government approach. Thank you.
Well, thanks, Christine, and good morning, everyone. It is terrific to be a part of this very important launch of this very important strategy. And it's great to be here with Greg, Christine, with you, with Lucy, and all of the many other people who join us for what is a really important milestone for the country, and something which I think we'll look back on in future years as a really important development in mental health policy in Australia. I'd really like to thank the advisory group, the co-chairs, the expert advisory group, the kids who have been involved and consulted on the strategy, parents who have been involved, and everyone who's had input into this strategy. It's been a very focused and deliberative process led so well by the Commission, and it's produced some exceptional work. So thank you to everyone who has been involved in producing this important strategy. And it's particularly important because we know that around the world, not just in Australia, but around the world, there are significant challenges with children's mental health. And we see that in the evidence. We see here at home in Australia, significant increases in the use of mental health services by young people in recent years. That has shown itself in terms of overnight hospital stays, visits to psychiatrists, emergency departments, and mental health presentations generally. So the evidence is clear that there is a great need for a continuing focus on children's mental health. And there are a number of important initiatives already underway, which I'll come to in a moment. And this strategy will help to guide further future activities. The imperative for promoting the well-being of kids and preventing mental illness is very clear. It's the right thing to do morally. It's the right thing to do for our society, and it's the right thing to do for those kids, for their families, and for the economic development of the country too. Because of course, mental health issues, as the Productivity Commission found, do have a very significant impact on the broader economy as well. And we're deeply committed to protecting the mental health of our young people. What can be more important? What can be more important than helping young people to deal with mental health issues? And until now, although there's been lots of great work done, we haven't had that cohesive national strategy that we now do. And that's why this work is so very welcome. It's national, it's inclusive, and it's a signal to everyone, to governments, state and federal, to the sector, of the key priorities that we need to work together on in the best interests of each and every child. Provides a really important framework for preventing mental illness and reducing its impact on children, families, and the broader community. And there's no question that it will help to guide and inform our investments and commitment to the health and well-being of kids and young people. And as Greg mentioned, some of the policies which we announced in our $2.3 billion National Mental Health and Suicide Prevention Package in the budget very closely align with the strategy. For the 2 out of 3 parents who say they wouldn't know if their child was struggling with poor mental health or what to do about it, we've committed to free access to online parenting education and support. And this is so important because for parents, knowing what to do if you have a child who's struggling with mental health issues is so important, and it's not always easy. And these parenting programs will assist thousands of Australian families to get better information and be prepared to help their kids through mental health issues. We also, with the states and territories, plan to establish a network of kids head to health centres, as Greg mentioned, for kids under the age of 12. Headspace does a phenomenal job for kids and young people over the age of 12, and in the budget, we put an additional $280 million into Headspace. But what the Head to Health Kids Centres will do is focus on those younger children, 9, 10, 11-year-olds, and provide an appropriate environment for those kids and their parents to come in and get multidisciplinary support in an environment that is specifically designed for younger kids and their families. And they'll improve early intervention outcomes. And we know from all the research that acting early is the right thing to do, so that we can give kids and their families the best possible opportunity to work through those mental health issues and give them the best possible future. As I mentioned, we're strengthening and expanding Headspace through an additional $280 million investment. And we're also increasing the number of better access group therapy sessions and allowing for family members to access up to 2 of a patient's available Medicare subsidised better access sessions each calendar year. That's really important because it means that parents will have more opportunities to talk with their child's clinician about the needs of the child and how the family and the professional team working with the child can better support them to work through those mental health issues. We continue to back Kids Helpline, which for many years has done a phenomenal job of helping children in distress, and a range of other initiatives as well. But there is more to do, as the strategy acknowledges. And part of that is that we need a better understanding of the underlying causes of why the mental health of children and young people has been going through so many challenges in recent years, and use what we learn to ensure that our programs and services within the health system and beyond are targeted and are fit for purpose. That's what we all want for our kids. It's what they deserve. And this strategy will help immeasurably for governments and the broader sector to focus on the things that benefit children the most. Thank you all again for this tremendous work in putting together the strategy. And Christine, thank you in particular to the National Mental Health Commission.
Thank you so much, David. That was really fantastic, and I'm certainly going to we'll have the opportunity soon to acknowledge and thank a number of people who've contributed. In particular, though, it would be remiss to not, at this point again, remember our co-chairs of the steering committee and the expert advisory group, Professor Frank Oberklade and Professor Christel Middeldorp. One of the other things, Minister, that really struck me there as we think about our head to health clinics and as we really reach out on this is not only are we going to need all of our professionals outside health contributing, but how important it is for each of our mental health workers who will be involved. And I know the head to health clinics are going to be an opportunity, whereas I saw in one of the comments, certainly it's an opportunity for our GPs, our paediatricians and others to be involved, but also, of course, our psychologists, our psychiatrists, our mental health nurses who are incredibly important, and across the range of the different disciplines that help us. I think we are recognising just how broadly we must rely on each of those disciplines to help us through. So thank you. And we look forward to hearing about more of them. As Lucy mentioned up at the top of this, the work of the Commission has an absolute core value, and that is the voices of lived and living experience. Those voices were incredibly important in the strategy, and we're thrilled to now share with you perspectives from experience. This includes children, parents, and a broad range of practitioners. Thank you.
My name is Isla, and I'm 5 years old. And when I feel sad, I color in. When I feel happy, I dance.
How do you know when your friend is feeling sad?
They just sit on the bench and stay there and watch everybody play.
And what do you do when you see that?
I just come to them and help them.
Why do you want to help them?
Because they're feeling sad like I feel sad every day, and I know how that feels.
We need to focus on building sturdy brains through nurturing relationships, through good experiences that promote growth and development, through healthy environments, and through really promoting those strong social and emotional developmental milestones, which are actually critical for our development later. And of course, if we do all of that, then this will establish the foundations for wellbeing and resilience throughout our lifespan.
I think it's important to educate, parents and carers about mental health. That way, we are aware if things may arise, and at the same time, children exhibit different signs comparative to adults.
It's really important that early childhood educators and teachers, as well as families and carers, all of the adults involved in a child's life, understand what good social and emotional development looks like, what's healthy in early childhood, and to also be alert to signs that children might be struggling or having difficulty with their mental health. This is when we can intervene early.
If you intervene early when the brain is more malleable, before things have become permanent in terms of changes to brain development, structure and function, then this is much easier to intervene at this stage. So the earlier we intervene in life, the earlier we intervene in distress and in the onset of illness, the chances for better recovery are much, much greater.
Practitioners, both individuals and in teams, need to establish evaluative frameworks for client practice. Circumstances change, practices come and go. Evaluations of how children are coping in different aspects of their lives is really outcome evaluation that enables practices to be adapted and evaluated on an ongoing basis.
We know that if we give children the best start, the right start in life and development, then they are going to grow into happy, healthy adults. And although we have many stories to tell, wouldn't it be nice if we could tell the best story of all? And that is, we put in the investment that was required, we built the systems of care that we needed, and it didn't matter who you were or where you lived or who your family was, every child got the chance to achieve the best possible well-being.
It's been a tough time for kids in this COVID-19 lockdown. But the world's changing. We have family and friends to reunite us again.
Wasn't that lovely? Now, I'm going to put a challenge out to everybody in the chat, because absolutely appropriately, I'm not mentioning everybody who is going to be critical going forward. And I do at this point do a shout out to our mental health social workers, our mental health OTs, everyone else that I am omitting to mention specifically. But the shout out I want to give to everyone is that this strategy is going to involve implementation by each and every one of us. I think the shout out is for you to identify and possibly put in that chat how you think you can make a difference from the perspective of your profession, because we certainly want to hear from each and every one of you so that we can scoop it all up to make sure that we have the best chance of making this really work. So now to our expert panel. Now, Alex, this is probably going to embarrass you a tad, but Dr. Alex Haynes, as I said, our Executive Director of our policy team, who's now gone off screen, I've noticed, has led this extraordinary work. And I also acknowledge the work of Lyndall Soper, who, as our Deputy CEO, has worked with Alex and led Alex through this. Alex, to you and all your team, thank you for what has been an incredible contribution to our mental health landscape. I acknowledge the work of each member of that team. Sarah, who is now moved on from the commission, but was incredibly involved in it. Susan, Paige, everybody else. Your leadership and ability to create clarity from complexity has brought it to fruition today. It's been a true labour of love over the last 2 years. I know that we will now be acknowledging the incredible input of our co-chairs, of our commissioners, of those who have worked on our expert advisory group. I think I'll leave that to you to take a lead on, to introduce our expert panel and to perhaps unpack this a little bit more for us. So Alex, passing the baton over to you. Thank you.
Thanks, Christine. And yes, that is very embarrassing and quite enough. Thank you. Look, it's my pleasure now to acknowledge the traditional owners of the land on which we're all on. I'm lucky enough to be on Darrell country in Wollongong, and I pay my respects to the elders past, present, and particularly in the context of a children's strategy, I pay my respects to the future leaders of our communities. I'd also like to say a massive thank you to everybody who's contributed their personal insights and professional experience to the work of this strategy. I hope that you can all feel very proud of what it is that we're able to launch today. So I'm lucky enough now to be joined by a few of the people who have contributed significantly to the work of this strategy for a bit of a panel discussion. So I'm just going to take a few moments to introduce each of them before I ask them some questions. So in a particular order, Professor Frank Oberclay is the Foundation Director of the Centre for Community Child Health at the Royal Children's Hospital for over 25 years. He's co-group leader, Policy, Equity and Translation at the Murdoch Children's Research Institute and an honorary professor of paediatrics at the University of Melbourne. Frank was also a co-chair, as has been mentioned a number of times, of our expert advisory group and steering committee, and was tasked with supporting the work of developing this strategy. The other co-chair that has been mentioned as well is Christelle Middledorp. Professor Middledorp holds a conjoint appointment with the Children's Health Queensland Hospital and Health Service and the University of Queensland. And both Frank and Christelle, I'll just say from a personal perspective, have just been super lovely to work with through the development of this strategy. So my heartfelt thanks to both of them for their contributions. On the panel, we've also got Dr. Jim Waterston, who's Dean of Melbourne Graduate School of Education and was also a member of the Expert Advisory Group for this strategy. Jim brings 39 years of experience across a diverse range of educational roles and sectors, including 6 years as the National President for the Australian Council of Education Leaders. And last but certainly not least is Professor Nairi Brown, who's also a Commissioner of the National Mental Health Commission, and is a Eora Nation woman from the south coast of New South Wales, not far from where I am. Nairi was the first identified Aboriginal medical graduate from New South Wales and one of the first Aboriginal doctors in Australia. Nairi is now the founding director for a not-for-profit dedicated to Aboriginal child and adolescent wellbeing that supports communities to develop strength-based approaches to breaking intergenerational cycles of trauma and disparity. So thank you and welcome to all of you on the panel. Nai, I'm actually going to start with you first, if that's okay. So you might want to take yourself off mute. The question that I've got for you is with regards to one of the focus areas in the strategy that looks at the importance of family and community. So the strategy emphasises the need for community-led, place-based approaches to meet the needs of children and families who experience significant disadvantage. Why do you think that's particularly important in this strategy? And Nai, you're just on mute still. If you press the screen, there you go.
No, but I'm using...
Okay, perhaps if you go back on mute, we might come back to you, Nai. All right. So Frank, we might just jump to you, and Elaine, I'll get you to talk with Nai to see if we can sort out her audio while we're waiting. So Frank, working as a paediatrician and on this strategy, we certainly had a lot of conversations about how the strategy needed to highlight a raft of improvements that are needed across the service system, including things like greater collaborative care and greater access and equity. Why do you think those factors are important for children and families in particular?
Thanks, Alex. I think the service system for children and families has two major roles, if you like. One is to provide the support and scaffolding that all parents need for advice, for reassurance, for guidance about raising children. And the second major role is the capacity to detect at an early stage emerging signs of mental health issues, manage them as appropriate, refer those children who need more expert care. I think we're doing pretty well, reasonably well in the first one, but not the second, and I'll just elaborate. So the vast majority of children cause concern at some stage of their lives. All parents can attest to this. They get anxious, they get frustrated and angry, they have temper tantrums, they may have sleep problems. Often they're very transient. Parents cope well with them. They realize that this can be a perfectly normal part of growing up. They may talk to other parents to get some advice. They go online looking for solutions. But they often turn to providers, to the service system for that sort of advice. They'll go to their GP, they'll go to the maternal and child health nurse, and so on. And one of the things in the strategy that the Minister mentioned is the introduction of a continuum to try and reduce stigma, to make it more likely that parents will go and seek help, to reduce any sort of stigma they may feel in getting that sort of guidance. But these professionals also play a very important role, as I mentioned, in the early detection of problems. That these children go to childcare, they go to the community nurses, they go to preschool, they go to school. So there's an infinite number of opportunities for professionals to notice that things aren't quite right. And I think that's one of the differences between child mental health services and adult mental health services. So the universal system, as I mentioned, works well. Compared to other countries, it's high quality, it's accessible, it's affordable. There are workforce issues, as we found, around numbers of those providers and about their training and expertise. But from a universal point of view, it works well. I think the major challenges, as has been alluded to before, are not in those universal services, but in the specialized workforce, in the specialized services that these universal providers refer to. This is a system in need of reform. There are often unclear referral pathways. GPs and nurses and teachers don't know where to refer to. There's a problem of access and equity. There are long waiting lists. Some families can't afford care. There are workforce issues, as we found. There just aren't enough mental health professionals in the system. There aren't enough psychologists who've worked with children. There aren't enough pediatricians, allied health professionals, social workers, child psychiatrists. We need more of them. But it's also a fragmented system, so that children's services are often usually located separately from family services. So where we see children with complex problems, where we need a family assessment, where families need help, that's in a physically different setting, geographically isolated. And there are particular issues, of course, for rural regional areas where the workforce simply isn't there. So it's very hard for most families, for many families, and indeed for professionals to navigate that system. So we do need to look at children and family services in a different way. We recommended strongly, as you're aware, child and family hubs, the sort of one-stop shop where children can go and get multidisciplinary care if they need it, where the families can be assessed and managed and given advice. We talked about new models of delivery, including telehealth, different funding models to facilitate professionals spending time with children and with families, and also a workforce strategy. So we hope that the strategy will point the way, will be a roadmap. If we really can achieve what we set out to do, and that is develop a responsive and integrated service system with increased capacity, a well-trained workforce, timely and accessible support for children and their families, then we've gone a long way to achieving what our vision is. Now, this won't be achieved overnight. We're talking about a 5 or 10-year plan, as you know, but if we can do this, if we can change our approach to the way we look at children's mental health, to children's development in general, there's multiple benefits: increased well-being of children, decreased stress and anxiety for their parents, prevention of problems becoming entrenched, that is early intervention, reducing pressure right across the whole system, but particularly on the tertiary workforce. And then, of course, we reduce the prevalence of problems in adolescent and in adult mental health. So all in all, it's a very worthwhile endeavor. And if we can do that, it's a sound investment, not just in human capital, but we think it's a sound economic investment as well.
Yeah, absolutely. Thanks, Frank. And one of the things that we talk about in the strategy as a way of making sure that the services are hitting the mark better than maybe they have done in the past is to involve children and families in the co-design of services, in the evaluation of services, etc. So I might just try Nairi again now, off the back of what Frank has said, and also, I suppose, alluding to what I was referring to with co-design. One of the things that the strategy talks about, Nairi, is around the need for community-led, place-based approaches, where the community is coming together to inform what that community needs to address its mental health and wellbeing issues. So I'm just wondering if you could maybe speak to why that particular type of approach is so important in the context of a children's mental health and wellbeing strategy. You're on mute though.
The host has to unmute me.
Okay. So Nairi's going to try and connect via phone, and we'll have to come back. Yeah, okay. So we'll have to come back to Nairi again. I'm sorry about that, Nair. Might go then to Jim. We'll look at maybe another one of the focus areas that's in the strategy, which is around the education settings. So this includes early childhood education as well as primary schools for 0 to 12-year-olds. When we were developing this strategy, and actually whenever I've done any work around mental health or suicide prevention, I've always found educators incredibly passionate about the role that they can play in supporting young people's mental health and wellbeing. They're often first at the table and super keen to hear about what they might be able to do better. Why do you think education settings are so critical when we're talking about improving child's mental health and wellbeing?
Yeah, thanks, Alex. I agree with you. And schools are the eyes and ears of society, really. Teachers get to see the best in families and young people, and they see the challenges and complexities around some of the issues that create barriers to learning. So you're right about that passion and the commitment that I think all teachers have to giving every young person the best start in life. So it's the universality of the schooling system that makes them so pivotal in terms of this particular strategy, but of course most of the issues that occur in everyday society. But in terms of mental health and wellbeing, then teachers build trust and relationships with their students, and so they are able to identify when things are wrong. They're able to get a sense of knowing when there are problems that young people don't want to talk about, and so we need to tap into that experience and knowledge and use them to help us focus on early intervention. And we've heard other people talk about early intervention today. And that's what the school system is built on. The earlier we can intervene with literacy problems, numeracy problems, but of course, wellbeing and mental health as well, then the more likely it is that the resilience and the protective factors will be in place and that young people will progress into fully functioning and capable adults. And so the idea that schools focus every day in this area makes them completely pivotal in this strategy. I guess the other part is that the pandemic, it was a bit prescient really when we started working on this strategy before we were sort of focused by the pandemic. But what's happened during COVID is that in Australia in particular, the community has realised the frontline and pivotal nature of work that teachers do. I think everyone's always respected teachers, but we've seen now that the innovation of creating new ways of learning, but also being able to focus young people and talk about their mental health and well-being during these really challenging times that we've had in different states. So the idea of working through in the pandemic is really central, I think, to what this strategy was all about. And it is about being out on watch, making sure that we can identify where there needs to be intervention and where there needs to be support. I guess what teachers perhaps don't have is the expertise that this strategy talks about, and the resources and the ability to be able to get professional development and to understand what it is that they should be looking for, and to take some of the pressure off teachers being that central person that has to identify all of these things for young people. So I think this is a fantastic opportunity now for schools and education systems to be able to equip teachers with the additional knowledge and skills that they'll need to be able to fulfil this role that they've always undertaken.
Yeah, great. Thank you, Jim. Now, Nairi, I'm hesitant to try again, but how's your audio going now?
Can you hear me?
Yes, we can. So that's great.
Oh,
so,
thanks.
Nairi, what I will do, you've heard me say the question a couple of times, but off the back of the what Jim said around schools. I mean, certainly in the context of the children's strategy, we heard lots of people talk about schools, particularly primary schools, as like a beating heart of communities. So that's maybe a nice segue to talking about, like, what do you see as the importance of community-led approaches when we're talking about some of the children and families who are within communities that are experiencing significant disadvantage, and how important is that to making sure that we realise the ambition of this strategy?
Oh, honey, and what I was trying to say is mitigated gurung buruk to everybody, so I acknowledge the traditional custodians upon each of the lands that you live, grow and raise your families. And shout out to my colleagues, to each of you, to the ministers. Shout out to Minister Hunt in particular, not only for his leadership in this space, but for, I think that's the nicest, I was going to say it's the nicest thing a minister said to me, but I think it's like the only nice thing a minister has ever said to me. So I'll take it where I can get it. In terms of your questions about place-based approaches, I think there are several key benefits to place-based approaches, and particularly when we're addressing the complex issues like child and adolescent social and emotional wellbeing and mental health. So place-based approaches tend to a more comprehensive optics, so they're close enough locally to be able to appreciate context and to capitalise on local knowledge, on leadership and talent, but they've got scope enough to be able to lean back and consider the broader landscape and its opportunities as well as its complexities. I think that's important. Place-based approaches, they align more closely to that social ecological model that really tickles my fancy. So it's child-centric, but it targets the entire community across multiple proximal and distal influences of safety and wellbeing. So family and home, school, peers and social agency, community in the built environment, economic and political circumstances, such that, the focus is on munchkins, but also then how we articulate strategies that are relevant to each of those layers of influence. And we also know from evidence that we need to reconsider and reconfigure how we respond to children and families, particularly those that are marginalised or have additional disadvantage layered across what are normal circumstances. So we know that the most powerful predictors of health and mental wellbeing actually lie outside of the health sector. Schools in particular, for example, have an enormous opportunity to influence our children positively, and particularly as social frameworks shift over time. Therefore, that whole of community and place-based approach makes absolute sense. And we know they work because places shape well-being. Feeling connected really matters, and centralised decision-making and orthodox, top-down approaches and systems, they fail to reduce inequalities. And further, where we have local services that have to work in an isolated sense, they have limited capacities and capabilities to support children and families to the full extent, and to keep them physically and psychologically well, let alone have to manage, at risk and unwell. So all successful place-based initiatives, they're characterised by strong leadership and backbone organisations, be they community-controlled Aboriginal health services or organisations, schools, childcare, primary care providers and specialists, but they're best placed to be able to identify, understand and respond to local need, and therefore champion significant and sustainable change across the life course.
Great, thanks, Naya. And I'm glad we finally got there with the audio. Really good to hear your perspective on things. Now, I noticed the time, so we've got one more question for the panel before we wrap up this webinar. It's a really important question, one that sparked lots of conversations through the development of the strategy. But Christelle, the fourth focus area for the strategy is around evidence and evaluation. And we really talked a lot in the strategy about the importance of collecting meaningful data, not just any data, but meaningful data, and embedding that within services. I just wanted to ask you for your thoughts on how important is it that this element is truly embedded within service delivery?
Hey, thanks, Alex, and thanks for your work on all this, and thank you all the other people. I was very pleased that I could contribute to this, and very happy to see the end product. The question is great. I think it's essential that data collection and high quality research are embedded within service delivery. And ideally, every family and child who gets into a service for mental health should have the opportunity to provide information on the outcomes and also provide feedback on how they thought the service was delivered. Because in that way, we can ensure that the services we deliver are valued by the families, and also that we achieve the outcomes that we expect from those programs. The other thing is, so that's more about service evaluation. The other thing is that all families also should have an opportunity to participate in research projects, because there is still so much we don't know about the optimal way to treat children below 12. And don't get me wrong, I mean, there are evidence-based treatments for this particular age group. It's just that we don't know which children are going to respond to which treatment. So that's always trial and error. And then as soon as the regular treatments fail, there is a lack of second line opportunities for other treatments. On top of that, that was the situation when we started the strategy. Now we have COVID-19, which is accompanied by a huge increase in need for mental health support. So we really need to start to be thinking of innovative and creative ways to deliver the treatments. Can treatment be done online? Which children don't need 10 sessions, but only need 5 sessions? To develop these new treatments and also these creative treatments, we definitely need to include families and children in the design of those new treatments, and also how do they think we should evaluate those treatments. And then we should test them directly in the real world, because if we test them in the real world, then the results are immediately translatable to clinical practice. And I think with the Head to Health Clinics initiative, this provides a great opportunity to embed research and service evaluation from the get-go, and to use the same measures across the whole of Australia. And then we will have this continuous feedback loop of evaluation, research, and improvement of the service in collaboration with the children and the families.
Thanks, Christelle. Yeah, no matter what we're talking about in the strategy with regards to what's happening within communities, what's happening within education settings, or what's happening within the service system, it's really critical that we check that what we're doing is having the intended impact. So thank you for that. And great to have children and families actually participate in that feedback loop as well, so that we can all keep learning. All right, so thank you to Christelle, thank you to Frank, thank you to Naya, thank you to Jim. It was great to have your thoughts today. Thank you for all your contributions to the strategy work over the last couple of years. It has been a pleasure working with you, as well as everybody else who's been involved in the development of the strategy. I'm now going to hand back to, I think, Christine to close off the webinar.
Thank you. And yes, so wonderful to hear from Frank, Christelle, Naya, and Jim. Thank you. So that's what a wonderful strategy launch this has been. You can find a copy of the strategy on the Commission's website. So just hop onto mentalhealthcommission.gov.au. Just to finish, and I think to echo that call out that we all have a role to play. Lucy, I know that this is a little bit unrehearsed, but maybe I could just pass to you as our chair, just to do that call out to everyone. You put it so well at the beginning that we all have a role to play here. So I'll sign off and thank everybody, and allow Lucy as our chair just to make some concluding comments, and then we can close off. Thanks, Lucy.
Thanks, Christine. And thank you all for joining us today for this launch. And as I think all the panelists have said, acknowledge the hard work that's come up through communities right across the board, from all sorts of workforces, from families, really with some fantastic input into this strategy, and it will only live and breathe with the support of all of us, whether that's as parents, as carers, as clinicians, as social workers, as clinical practitioners in this space, as just people that love and care for the future of our children. We've all got a role to play. And so I would really encourage you to all go and take the strategy, see where you fit into the strategy, and start to bring it to life in your community. There's big investment, as the ministers have outlined, from government, but a lot of this just takes conversations with one another across our services to wrap around our kids and really bring this into something that is so fundamental. And if I go back to those words of Mari Bashir and so many others that have worked in this space for decades, it really is about resetting trajectories, and it can be done. And this is something that should give us all incredible optimism. So thank you for your work to date. I am so optimistic about what this can deliver for our young people in this generation and in future generations. But we do need to work together. So let's get to work now and wrap up the Zoom. Thank you for everyone that's joined us, and let's get cracking. Thanks, Alex.